Welcome to Toledo Clinic Television. For this segment, Eric Thompson is joining us. He's a doctor of pharmacy. Thank you for being with us.
Thank you for having me.
And you're here to talk about something called MedSync.
Yep.
Is that a new concept?
MedSync started about 10 years ago in the world of pharmacy. Within the last several years, it's really caught on in the independents especially. And actually now we have some chain stores trying to do that, but they're not as good as independent pharmacies are at doing medication synchronization, or MedSync for short.
All right, explain what that is exactly.
It's a system where we have a pen and paper, which is actually better than a computer, which you would think the other way around, but actually pen and paper is better. We go through our charts every day and we get people's medications ready before they even need them. We start working on them well in advance. It takes care of if patients are out of refills, if we need to order a medication. And then we personally give you a call before you come into the pharmacy, and we will make sure that you have all the medications that you need on hand. Make sure we're not filling things that you don't need. A lot of times patients come to the pharmacy and they let us know once we've already filled it, oh, I don't need that. So we call them ahead of time and make sure that patients are getting what they need. It's only one trip to the pharmacy once a month. You can actually go up to 3 months if you would like, but a lot of patients just use 1 month. Yep.
Is it something that is exclusive to Toledo Clinic?
So we're the only pharmacy in Toledo that's doing the pen and paper method. No other chain stores have what they call a medication sync program. It's nowhere near as effective because it relies on a computer to tell you when you're supposed to fill something, and it's easy to just overlook that screen. To forget to do what the computer tells you to do. We have basically it's a shopping list of medications that need to be filled, and we go through and we mark them off as we complete them.
And you're right, it does seem like it wouldn't be as efficient.
Right.
But it's personalized, and I think that maybe is the key to, making sure that someone is getting the care they need.
That's true. It actually takes a lot of time off of the pharmacy staff and the pharmacists, because we can work on patients' prescriptions when we have time, and we're not reliant on the patient to call us multiple times per month and asking us to get a thing ready here, a thing ready there. We can work on it on our own time, which actually leaves more time for us to talk to patients about their questions. We can do more personalized things. We can do immunizations. There are all sorts of ways we can help patients more with more time on our hands. We have more time to talk to them.
I think most people see a trip to the pharmacy as just being sort of transactional, but it actually is a good idea to get to know your pharmacist, right?
Correct. Yeah, correct. I've been with the Toledo Clinic 12 years now, and I can't even count the number of patients that we know when they walk in the pharmacy. We know their name. We know about their lives, and it makes a difference to people. They like having a personalized care in their pharmacy team. They ask us personal questions, and they basically become like family.
And it's a good way to look out for potential interactions or adverse effects, because you know exactly what they're taking and when they're taking it.
Correct.
Yeah.
Yep.
All
Correct.
Right. So they should stop by the Toledo Clinic and get their medications synchronized.
That's correct.
All right.
We'd love to have them. Thank you.
Thank you so much, and thank you for watching.